Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about a very common problem, that is typhoid. Typhoid is very common and is endemic in India, and sometimes, quite often, people don't get hospitalized with typhoid and it is not reported to the health authorities. So, though there is a lot of typhoid, the exact number of cases is not known. So what happens, as soon as somebody has 3 days or more of fever, they self-diagnose typhoid and sometimes the doctor diagnoses typhoid. All fever is not typhoid. Some simple tests are done for typhoid, the most common being the Vidal test. A 1 in 80 positive Vidal is not typhoid. It should be 1 in 320 at least to diagnose typhoid. There are other ways to suspect typhoid in other fevers where the blood count, the white blood cell count goes up with the fever to tens of thousands. In typhoid it comes down. In typhoid there may be a mild rash all over the body. The best way to diagnose typhoid is to do a blood culture, but this is not available to everyone. The Typhoid test gives an 80% positive result for typhoid and it is done on a slide like the pregnancy test. Once typhoid is diagnosed, the person does not really need IV fluids or hospitalization unless they have developed some other complication. Antibiotics in the correct dose, if taken for 7 to 10 days, will cure the typhoid. At the same time, it is better to have a bland diet, take plenty of fruits and plenty of fluids. Unfortunately, the person often does not take the antibiotic for more than 2 or 3 days because it takes that long for the typhoid to respond to the antibiotic. So after 3 days they go doctor shopping and they change the doctors, and meanwhile the blood results are all confusing. Different antibiotics are given and the typhoid bacteria learns to live with the antibiotic and the person becomes very sick with a resistant infection. Sometimes some people can recover from typhoid even without antibiotics within a month or so. Those people can become carriers. That means they'll continue to excrete the typhoid bacteria in their urine and their motion. They will pass it on to all the members of their family. If the sewage is contaminated and the water supply is contaminated, they will pass it on to the entire locality as well. Women are more likely to become carriers of typhoid than men, and anybody who has a gallbladder problem with stones, the typhoid bacteria can go and live among the stones and the person can become a carrier and continue to excrete the bacteria intermittently in the urine. In order to treat a typhoid carrier, antibiotics have to be given for 1 month and sometimes the gallbladder also has to be removed. What people forget is that immunization is available against typhoid. The injections are of 2 types. One provides protection for 3 years and the other for 7 years. After this, a booster has to be taken. People who don't like injections can have the oral typhoid vaccine. It comes as capsules. 1 capsule can be taken every alternate day for 3 days and protect for 3 doses, and protection lasts for 3 years. The best way to prevent typhoid is to not drink unboiled and unpurified water, to wash your hands before you eat or touch any food. Do not buy food or vegetables which are raw and peeled and kept in the open. If you must eat in a hotel, eat food that is only piping hot. Even after immunization, you can develop typhoid, but the attack will be very mild and you are very unlikely to develop any complication. Stay fit, stay healthy, enjoy your life. This is Dr. Gita Mathai signing off. If you liked what you heard, please subscribe to my Health Vibes channel. The same content is available in Tamil. Thank you.